the option of a biologic tuberoplasty and how I do it in 2024. So we're going to try to answer some of these questions. How do we do this arthroscopically? When do we not do a reverse? Who's the right patient? Some technical tips and pearls, and what are the current outcomes from this procedure? Well, this is an everyday problem that we see. You can see this patient on your left has a big tear, but if you take a little bit of time to figure out where it goes, that is a repairable tear. So we don't want to do this in everybody, but that patient on the other side of the screen, there's really no appreciable rotator cuff that we can make come back to the bone. And so that may be a patient for a more salvage-based procedure that we can talk about. Well, I do like reverses. I do a fair number of them in my practice, but I think that there's some patients that we have a conversation and we find that they really don't want metal and plastic in their shoulder. They would like to avoid a replacement, and those are the patients that we're talking about here. There's good published results that long-term, some of these younger patients are going to have problems. So this is a hot topic without a great answer, and usually that means there's lots of reasonable options to do a non-arthroplasty option for a patient like this. Well, the generally accepted theory that JT just talked to you about is that if we can keep the humeral head lower, perhaps that patient's going to do better. Albert Lin showed us that maybe that might not influence the kinematics in an SCR. And so there's an opportunity here. How do we prevent the painful articulation of the humeral head with the greater tuberosity, or with the acromion, without an arthroplasty? So we have to go back to the beginning. If we look at Mihata's work, he got great healing and improved ASCS scores, but this has been hard to reproduce in our patients. When we look at the data from SCR, which is where the tuberoplasty concept came from, 59% of the grafts did not heal on postoperative follow-up.